My name is Andrew Glaister. Welcome to our clinic here in beautiful West Wales. Over the next few minutes I'm going to demonstrate some of the holds we use to get the best from the Fascial Edge tool. We hope you agree that this is a remarkable addition to manual medicine, and we want you and your patients to get the very best from it. While we're looking at the features and holds, please bear in mind the three main benefits of using the Fascial Edge tool. 1. You can work deeper and more thoroughly with considerably less effort. 2. You can cover large areas quickly, making the most of your time and energy. Lastly, and perhaps most importantly, using the tool reduces stress on your valuable hands and fingers. Looking at the tool, we can see how the long edge corresponds very much to the ulnar ridge, often used over the broader areas of the body itself. When we look at the ends, we see that one is relatively narrow and slightly pointed, and this is very much like the profile of our own thumb. Meanwhile, the rounded end has a profile which corresponds very much to our own elbow. Rather than talking about this, let's look at it in action with some examples. We'll start looking at the long edge of the tool, and we'll see how this works over the iliotibial band. The first thing we'll notice is how tightly the contours of the tool actually fit to the tissues of the body. So with a relaxed grip in the right hand, we're actually going to place the tool over the tissues and apply pressure using the metacarpal pads of the opposite hand. With a guiding pressure, we work through the tissues to the degree of patient tolerance. Note how both hands are in constant contact with the patient, guiding and giving direct feedback. Using the tool doesn't replace the hands, quite the opposite. It makes the most of them. Now let's look at the wider, rounder end of the tool. We're going to use this around the iliac crest, covering many of the important attachments in that area. With our patient prone and the muscles relaxed, we hold the tool on the patient. I'm making a pressure here with the hypothenar eminence of the hand and guiding with the fingers of the opposite hand to make a smooth traverse of the iliac crest. Equally, I could reverse my contacts and make a pull move, like so, in which case I'd be placing my fingers on the front of the tool to draw it towards me and in towards the lumbosacral junction. We're going to have a look at this same technique, but we're going to work a little bit higher up in the spine over the paraspinal muscles. If we adapt this push technique to the paraspinals, we suggest using similar holds, but angling the working edge of the tool. Note how close to the spinous processes we can get using this technique. We're using a pushing action, but just as well we could reverse that and make a pulling action, as we did around the iliac crest, pulling back and down towards us, working deep into those important muscles. It feels good and it makes for less movements around the table on our part. With the narrower end of the tool, we can work deeper into tight areas of the body. And here we're going to look at the sacroiliac region. Now, getting into the massive ligaments around the PSIS was always hard work using thumbs and knuckles alone. Using the tool, we can use a combination of push and pull. Now, here's a push around the lateral edge of the PSIS. We can continue that push around the inferior edge of the iliac crest. And similarly, here's a pull up around the crest, over the superior edge of the crest, and medial to the PSIS, working deep down to the periosteal insertions. As clinicians, we know that some areas of the body are pretty well impossible to access with the fingers alone. And as an example, we're going to look at the retinaculum and sulcus of the medial knee. As clinicians, we know that adhesions and fibrosis in this region can cause exquisite pain, but they can be difficult even to palpate. So firstly, we'll access the sulcus of the joint, locate that with our fingers, and then using the rounded end of the tool, we'll follow the sulcus round, covering the collateral ligament and the deltoid ligaments which hold the menisci in place. Small adhesions and areas of fibrosis here are exquisitely painful, as the patients will tell you, but this work can give remarkable results. There's no doubt about its importance, but you do need more than your fingers alone to reach these deep points. So that's a very brief overview of the fascial edge. Whether you're a chiropractor like myself or belong to one of the many bodywork professions, one thing is sure. Using the fascial edge will certainly make the most of your skills, it'll certainly make the most of your time, and at the end of a long day, your hands will certainly thank you for it.